Hi, I'm Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. SGLT2 inhibitors have been on the market for a while now, so veterinarians are able to describe their real-world experiences with this recent addition to the toolbox for feline diabetics. Here to share her experiences is Dr. Renee Rosinski. Dr. Rosinski graduated from the University of Missouri College of Veterinary Medicine. She's been a board-certified feline specialist for more than 20 years, and her hospital not only provides routine wellness care for cats, but also is a busy referral center for complex feline internal medicine cases, especially diabetic cats. So, Dr. Rosinski, thank you so much for joining me today.
I'm so happy to be here.
Yes, and I'm so happy to have you because, we've learned a lot about these drugs here recently, but I'm excited to hear, just some real world experiences. And I'd like to start with patient selection. So I think you have a really great way of explaining patient selection, how to choose the right patient. How do you choose the right patient?
Yeah, patient selection is incredibly important for SGLT2 inhibitors, which are an amazing alternative to insulin treatment in these cats. And we typically look for what we would call a healthy diabetic cat. So think about your typical fat and happy surfer dude kind of cat that just kind of incidentally is diagnosed with diabetes. Maybe he's come in on a wellness exam, and they're not all male cats. I just typically think about the diabetic cats as being these middle-aged fat dudes, but what we're looking for is a cat that is not sick from diabetes. And obviously diabetes is an illness, so they're sick, but these cats are still eating and drinking and going about their business, and it's almost as if we've made this diagnosis incidentally. We're looking for healthy diabetic cats that are the typical poster children for diabetes, usually the pudgy, dry food eating kind of dudes.
That makes sense. The pudgy dry food eating dudes who are, can't get enough of the water bowl. And the owners are so happy because he's lost 2 pounds since his last exam.
Right, right. We've been advocating for weight loss for years, and why they're losing weight now. The people are so happy the cat's lost weight, and we say, well, what have you been doing? Well, nothing. It's just great, and
It's a
the diet's
miracle.
finally working. And I'm like, yeah, the diet's not finally working. This is a problem, but yeah, I mean, these are typically relatively healthy cats.
Sure, sure. That makes sense. I always hate to rain on those parades, but we have
I
to with that
know.
blood work.
Yeah.
Well, thinking about these cats when we diagnose them, I guess my question would be, what would you say to a practitioner who is presented with this fat and happy diabetic, and they're trying to decide, do I start insulin? Do I reach for an SGLT2 inhibitor? I don't have as much experience with these new drugs, and maybe they're considering insulin because it just feels more familiar and more comfortable.
Yeah, I think that that's really, really common. I mean, anytime we're presented with a new option, it's a scary thing. And the way that these drugs work is different than anything we've had before. So the way we monitor is different. But I think that, if you've identified that fat and happy diabetic, you just kind of have to start. You have to start somewhere. Knowing what to expect takes a lot of the fear out of it. Um, there's no reason to be super scared of these drugs. They can be used very safely and very effectively with appropriate monitoring. And I'd say just jump on in.
I think that's such a good point. With any medication, we do have to start somewhere. At some point, we just have to make the decision and have that first case and have that experience. I know one of the points of hesitation can be the monitoring, because monitoring a patient who's on an SGLT2 inhibitor is different from monitoring a patient who's on insulin. So along the same lines, what if it's yes, we have to have that first experience, we have to choose that first patient, but the monitoring still scares me, and I don't know that I'm comfortable that I'll do a good job monitoring these patients.
Yeah, it can be a little scary starting something new, but remembering that when you have a brand new diabetic cat, this is the perfect time to start. Once they're on insulin, you can't go back to SGLT2 inhibitors, but you can start with an SGLT2 inhibitor, and if it's the wrong choice, you can always go back to insulin. That's fine. You just can't go back the other way. Um, Once you start the monitoring and once you get used to it and you start understanding the process, the monitoring of a cat that's on an SGLT2 inhibitor becomes incredibly boring. Um, you don't have to do blood glucose curves anymore because they just don't curve. You're not constantly having the cat back and forth, adjusting food, adjusting insulin doses, adjusting all this stuff. It becomes really something that is almost a non-issue, incredibly boring. And isn't that what we want in our lives? I mean, we don't want to be recreating the wheel all the time. We want our days to go smoothly. We don't like all the speed bumps. So having something that can make managing a complex disease so much more straightforward is almost miraculous. It's really, really cool.
I would agree with the word miraculous. It almost sounds too good to be true, like boring monitoring on a
Yeah,
diabetic. I mean, you hit the nail on the head.
I
This is a
know.
complicated disease. No two patients look the same. So the idea of, having a boring experience monitoring a diabetic, I'm like, sign me up.
Yeah, I think I'm putting myself out of the referral business for diabetes. I mean, and that's cool. That's great. I mean, that means these cats are getting great care and their complex disease is managed. And if we can make that more boring, then fantastic.
That makes a lot of sense. This hesitation that we're going to have with any new drug. There always has to be that first case, that first patient. And that message is kind of what I feel like I'm hearing across the board is it's not as scary as you think. You just have to reach for it and you have to give it a try.
Yeah, I mean, you have to start somewhere, and not all patients are going to be right for it, but a lot of them are. And once you start using it and develop a level of comfort with it, you'll be so happy that you jump off that diving board
Absolutely.
or
Absolutely.
cliff, as it might be.
Good point. Um, well, kind of along those lines of there being that first patient that we're going to choose, let's talk about cases a little bit. When we talk about these drugs, the recommendation is if we have a patient who's showing a rising ketone level while they're on an SGLT2 inhibitor, that we consider switching to insulin. But every patient is an individual. Every patient deserves their own individual consideration. And I understand you have kind of a good example of this situation.
Yeah, I think, just with any patient, whatever the problem is, I mean, you have to treat that particular cat and not necessarily all the numbers that go with it. I mean, it's all very important, but it's all part of a big picture. So if you have a cat that seems to be a good candidate, a fat and happy diabetic, a typical diabetic cat that you start this medication with, and their ketones start going up, it's absolutely something to pay attention to. But if the cat's feeling good, if the cat's still eating well and not clinically sick at all, you may be able to continue to monitor that cat and support them through it as their body gets used to managing or dealing with that SGLT2 inhibitor. I've had a handful of cats that we start on the drugs, they feel great, but we watch their ketones go up a little bit. And it is scary, and it's something that we absolutely have to pay attention to, but it's hard to ignore the cat that is feeling great and eating normally, and the blood sugar is coming down. So um in my experience with the handful of cats that we've seen that with, it takes a couple days, and as long as we're monitoring, those ketones have seemed to come down. The cats do fine as long as they're eating and drinking and feeling okay, then we kind of plug along. And that's definitely not the party line with the drug manufacturers, whether it's Invelgo or Bexacat. Um, but the the clinical trials have to cut things off somewhere, right? So the ketone levels that were chosen relatively arbitrarily, which is fine. As long as we're not putting the cat in danger, um, I think that's okay.
I think that's a really important message that if we are seeing those ketones start to climb, but we have a patient who is otherwise doing great, to not panic because I know speaking personally, that would probably be my inclination is like, oh no, they're going up, we have to change it. But when I think
Right.
of having that conversation with a pet owner, with a cat owner, and saying, oh, we have to go from this oral medication to insulin injections when nobody really is super excited about giving insulin injections to a cat every single day.
Right.
That can be a hard sell if they're doing fine on this oral medication. So it's great to hear you say, kind of don't panic in those moments and, just give it a little bit of time, make sure you're monitoring closely, speaking to that patient selection, making sure you have an owner who's going to follow up with you the way that they're supposed to and see if you can kind of get them through it a little bit.
Yeah. Yeah, exactly. That's exactly right. And sometimes it's not going to work. But a lot of times it will. And you just have to make sure that you're treating that particular cat. Um, and make sure you're straightforward with the owner. So this is a new drug, and we're going to do everything we can to keep your cat as safe as possible. But we want to make sure that we keep this as an option if it still is one.
Yeah, I think it sounds like, vet school 101 of treat the patient, not the numbers.
Right. And we forget all that
Oh yeah,
sometimes.
so easy to
Numbers are
forget.
scary,
Yeah.
numbers are really scary. And but we plug along and cats are cats and do what they want to do and make us all look bad sometimes. And so plug along,
That's like the perfect description of cats. They do what they want and they, like to leave us with egg on our face occasionally.
right? It's my less colorful way of describing cats.
I like it. I like it. Well, and along those lines of pet owners, the word's kind of getting out about these SGLT2 inhibitors, and it's certainly understandable that as owners hear about this, they would say, "Hey, let's
Yeah.
talk oral medication and not insulin injections for my cat." Not every patient is going to be a candidate for therapy with an SGLT2 inhibitor. So, can you give us an example to the contrary of a patient who really isn't that ideal patient selection, and maybe one where it wasn't the ideal patient, but you decided to try an SGLT2 inhibitor anyway?
Yeah, I mean, we get so much pressure from our clients and from our staff and from drug companies and from ourselves. We want things to be easy for our clients and for our patients. And so when you've got something that really eliminates clinical hypoglycemia and is once a day and no injections, and of course you want everything to be on this instead of insulin. And so I've definitely had cats that don't fit into that fat and happy kind of situation where my gut is telling me that this is not a, an insulin dependent cat, not a long-term insulin independent cat. Maybe this is a cat with pancreatitis. And I had a cat who was a senior cat, not obese. And the owner really didn't want to give injections and had heard about the oral medication. I told her it wasn't probably a good fit for this cat. She really wanted to try it. She understood the risks. So we did that. We started an SGLT2 inhibitor. We made sure we started it on a Monday. So we had all week to deal with any potential consequences. And immediately that cat's ketones went up and she started feeling sick. And we discontinued it and supported her through that and started her on insulin. And so the owner was aware of that being a possibility and was prepared for it. And so she wasn't terribly upset. She was disappointed. She was hoping that maybe her cat would be the one that, didn't have issues. But she was glad we tried. And now the cat is on insulin and plugging right along as she should and doing well. But uh, that cat not only had the ketones go up, but was feeling sick from it too. So absolutely not the right choice for that cat.
And just to clarify, with what you were saying with this being an older cat who is not overweight and is diabetic, my understanding with these drugs is that we need some functioning beta cells in order for this to work. And so if we have this thin old cat, theoretically, we're not looking at so much insulin resistance and probably we have lack of function in the pancreas. Is that kind of a somewhat right interpretation?
I mean, I think that's really a simple way to put it. Yeah, I absolutely. The cats have to be making their own insulin for this drug to work. This drug is providing a platform for the cat's own endogenous insulin. Um, so when we have a more geriatric cat, we don't know if the beta cells are still making insulin or not, and we don't have a good way to test that. But looking at the things that older, thinner cats have, a lot of them will have inflammatory bowel disease or small cell lymphoma, and that's very close to the pancreas. And so, do we know if all that inflammation is infiltrating the pancreas, or if those neoplastic cells are infiltrating the pancreas and creating problems and no beta cell function? And so, there are old skinny cats that will benefit from being on an SGLT2 inhibitor. But in general, it's going to be a riskier patient to do. And until we have a test that tells us whether the cat's beta cells are producing insulin or not, um, this is the risk that we're going to have to take.
I think that's a really practical way to kind of lay out that patient selection we're talking about and how important that is to say, why we want these fat and happy diabetics.
Right. Yeah. Because it's going to be more predictable that their beta cells are still doing beta cell stuff.
Doing what they're supposed to do. Gosh, and I
Right.
never thought about like a test to see if the beta cells are working. I always, I've say it a lot lately with all of the new options that are coming out. I'm like, man, what a time to be a veterinarian.
Right. Yeah. Yeah, exactly.
Yeah,
Soon, maybe, coming soon to a lab near you.
wouldn't that be cool, man?
That
We
would be
can
way
hold out
cool.
hope.
Right. It would make all of this. I mean, we don't even have to talk anymore because it would just be done.
Yes, yeah, you get this drug, end of
Right.
story.
Let's make ourselves obsolete. It's all
I
good.
was gonna say, yeah, maybe we don't want that anytime soon. Maybe we can hold off a little longer.
Right.
Well, of course, one of the other big fears with these drugs is this euglycemic DKA that seems very scary because these cats come in DKA, but they're euglycemic. So, how do you identify it? So, do you have a case of euglycemic DKA on an SGLT2 inhibitor that you can talk about?
No,
Okay.
no, I don't.
Love
I don't.
that.
It's super scary, right? You hear about that. Well, any DK is scary.
Right.
You have people, running screaming from the hospital if they
Mhm.
have to treat a DKA. So but how often does that happen? When you think about the DKA cats that you see, typically they haven't been on insulin, right? They've been these cats that have been sick for a while, missed for a while. Maybe the cat hasn't even been in a couple of years, and all of a sudden they come in and they've lost several pounds, and the owners are like, yeah, he's been drinking more for a week, and that's not true. But these cats have been sick for a while, and they haven't been a treated diabetic, and those are the DKA cats that we see. And then when we have an incidence of DKA in a cat that has been on insulin, It's very, very rare. We just don't see that. And the incidence of euglycemic DKA in cats that are on SGLT2 inhibitors that are appropriately selected is the same level of frequency in practical terms. I mean, it just is not happening that often at all. As long as the cats are producing their own insulin, the euglycemic DKA shouldn't be happening. So no, I don't have any incidences of it to speak of. I've never seen one. I haven't even heard of one in my circle of nerds. Um, and I think that's great. I think that's great comfort to people just starting out using these drugs that yes, it's scary, and it's even more scary because these cats aren't coming in hyperglycemic. But if you think about sick cats, sick diabetic cats that come in after they've been treated for a period of time, when you see a sick diabetic cat on your appointments for that day, you automatically think of two things, right? The first thing you do when they come in is check their glucose because you're afraid they're hypoglycemic, right? So that's not going to be a factor with these drugs. The second thing you test is ketones, right? So everything is still the same as far as identifying these cats. So if they are having either high blood level ketones or high urine ketones, then you know you have to treat these things. But the level of panic of having a sick diabetic cat come in should be about the same whether the cat is on insulin or an SGLT2 inhibitor. You're going to look at the same things, but you're not going to see hypoglycemia in a SGLT2 inhibitor cat. Does that make sense?
It does. It does. And I think that's a good message that, that we continue to reiterate of if you have a sick diabetic cat, who's been treated, who hasn't been treated. If you have a sick diabetic cat, DKA is going to go way up high on your differential list. So it's one of those that you're going to be looking for anyway. And just to clarify,
Right.
when we are checking for ketones, because we're monitoring and we're tolerant of the BHB to a certain level, what's kind of our criteria since we have this euglycemia to say like, yes, this is a DKA cat?
Um, I would love to give you one hard and fast cutoff number for that. Most of the cats that are well regulated and not sick are going to have BHB levels under 2. I think when you've got something between 2 and 3, you have to start being a little bit worried about it. But anything over than that, with the concurrent clinical signs, I think you have to be really cognizant that your beta cells aren't functioning anymore, and especially we're expecting these cats to be really sick. DKA cats are sick, so if they've got the clinical signs, the increasing BHB, and the concurrent electrolyte abnormalities and everything that goes along with that, then it's walking like a duck and talking like a duck.
So it sounds like any disease process where they're, kind of like we talked about before, treating the patient and not the numbers. So look at the
Yeah,
numbers, look at your patient, and then put the pieces together from there.
exactly. Exactly. Yeah.
Well, Dr. Rosinski, this has been just a great talk. I feel like this is a really practical approach to using these drugs for general practitioners to say, okay, when you have it in your hands, these are the things that you want to consider and what you want to look for in very, usable terms. So thank you so much for joining me today. Thank you for such a wonderful conversation.
Oh, you're welcome. It was fun, and I hope it gives some people some comfort.
And thank you to Boehringer Ingelheim for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day. Important safety information. Cinvelgo, velagliflozin oral solution, is indicated to improve glycemic control in otherwise healthy cats with diabetes mellitus not previously treated with insulin. Before using this product, it's important to read the entire product insert, including the boxed warning of diabetic ketoacidosis or euglycemic diabetic ketoacidosis, both of which may result in death. Development of these conditions should be treated promptly, including insulin administration and discontinuation of Cinvelgo. Do not use Cinvelgo in cats with diabetes mellitus who have previously been treated with insulin, who are receiving insulin, or in cats with insulin-dependent diabetes mellitus. The use of Cinvelgo in cats with insulin-dependent diabetes mellitus, or the withdrawal of insulin and the initiation of Cinvelgo, is associated with an increased risk of diabetic ketoacidosis or euglycemic diabetic ketoacidosis and death. Sudden onset of hyperexia or anorexia, lethargy, dehydration, or weight loss in cats receiving Cinvelgo should prompt immediate discontinuation of Cinvelgo and assessment for diabetic ketoacidosis, regardless of blood glucose level. Cinvelgo should not be initiated in cats with ketonuria, ketonemia, pancreatitis, anorexia, dehydration, or lethargy at the time of diagnosis of diabetes mellitus, as it may indicate the presence of other concurrent diseases and increase the risk of diabetic ketoacidosis. Keep Cinvelgo in a secure location out of reach of children, dogs, cats, and other animals to avoid accidental ingestion or overdose. For full prescribing information, visit cinvelgoclinic.com. That's SENVELGO clinic.com.